Hello friends, I'm Vivek Atray and we're on the Good Vibe Show. And today we're going to highlight something which is very, very important. And we have friends Preeti, Nikita and Abeer. And I'm going to tell you just what is so special about them. First, Preeti ma'am, you are wearing purple and you want to talk about the reason for that. But first, tell me how you became a successful author. So let's talk about that first.
Thank you for inviting me, Vivek sir, and this is such a good opportunity. And to be sitting with you is I'm feeling so blessed. And why I'm wearing purple? Because this is the purple month, Epilepsy Month. And we wear purple because basically people try to hide the reason for epilepsy because it's supposed to be, the purple color is supposed to be hidden. It's lavender, it's a beautiful color, but the people try to hide about epilepsy and we try to wear purple so that don't hide about epilepsy. The stigma is so deep, please don't hide. That's the main reason we wear purple. And
but before that, before we talk about epilepsy, and you very rightly highlighted the main purpose in the very beginning, before you discovered or before the episode started, how was your life going and you became an author, you were successful. So tell us the pre-epilepsy phase.
I think you launched my book, Flirting with Fate, 10
Long
years
ago,
back.
Yeah. They were not the only one, there were some other people as well, I remember.
But you were...
10 years, was that 10 years back? My
2012.
God. All right.
And so I became an author in 2012 and I really did not, I was living life with epilepsy since I was 2 years old and I really did not, it didn't hit on having medications, being with doctors, living my life normally, and I was, parents looked after me, my sister looked after me, everything. I was living life as a warrior. It didn't really hit me that I am facing so many problems as a person with epilepsy. But when I came across a friend's son passed away due to epilepsy. And that's when it hit me that I have the talent of writing and I have the disorder of epilepsy. I think I should make people aware about this disorder.
So you started writing on this topic, and earlier you were writing on
before my call comes from the Almighty, I think it's time to make people aware about epilepsy. And
that's the call from Almighty, we'll keep it delayed. There's no hurry. There's no hurry.
That's when I wrote the book on epilepsy.
And we're bringing in the doctors here because Nikita and Abeer, special guests on the show. They are neurologists and accomplished doctors and from AIMS and PGI. We are in Chandigarh right now and we are shooting this at the State Guest House in Chandigarh. The reason for inviting them is to shed more light on the subject, the topic. And since Preeti ma'am is the person with epilepsy, as we call them, PWEs, so Dr. Nikita, will start with you. What is your view on what she said? I mean, firstly, I want to, because she brought it up, somebody passed away. So how serious is epilepsy? How much of a problem is it? Are there varying degrees? Would you like to talk about that?
Yeah, so hello everyone and thanks a lot for inviting us for this show. I would just start with the basics. So epilepsy, mirgi, fits, seizures. So it is a very basic disorder. Our brain is basically an electric circuit. So whenever there is a abnormal excessive discharge going on, like in a layman manner you can say there is short circuiting in the brain. So there can be discharges in some part of the body. So it could be either in the hand, either in the legs or in your eyes, anywhere it can affect. So your patient can start having these fits. So they can have these abnormal jerky movements. वो हिलने लग जाते हैं, झटके लगने लग जाते हैं जो हम बोलते हैं फिट्स होती है, मिर्गी होती है. So that is what is we call a seizure or even convulsion attack, जिसमें हमें कुछ ऐसे we get these things that वो हिल रहे हैं, झटके आ रहे हैं उनको and all. But this, if it keeps on having recurrently, बार बार होने लग जाते हैं, then we call it as epilepsy, which is मिर्गी. मतलब उनको बार बार ये seizure के attacks हो रहे हैं. Right. Now coming to this topic, whether it can be a fatal disorder, whether it can be life-threatening, yes, definitely we can say it can be life-threatening if it is left untreated. If the person is again and again having those episodes and it is getting neglected, either because of lack of knowledge, because abhi hamare India mein there is a lot of rural population, they have such an amount of ignorance towards this. उनको पता ही नहीं रहता, उनको बहुत टाइम लगता है कोई गॉडली थिंग हैज कम इनसाइड द बॉडी, कुछ कोई माता आ गई है,
lot of
superstitions are there, lot of myths are there. They go to so many other gurus, pandit ji, religious pujas, ये करवा दिया, वो करवा दिया.
Exclude gurus and panditjis. They go
Yeah.
to some other kind of
Yeah,
people.
yeah, some other quacks are also there in between and many other people. So they go there, they rush there, ki, you know, they can get treated. And they keep believing it for a long, long time. Till the frequency keeps on increasing.
Yeah, it
because
becomes
they are
dangerous.
not,
It can become.
Yeah, so it can become. And there could be circumstances where the patient is actually, जैसे again I would go to the rural population कि वो रोटी बना रहे हैं आग के साथ चूल्हे पे, and suddenly the patient has a fit and they directly fall into it.
Oh my God.
वो चूल्हे में आग में ही वो, and they get that burn injury. So it can be fatal. Or someone is driving a car or a scooter and they suddenly get that fit and they have a road traffic accident, and you never know how deadly it could be. So these are the instances when your seizure actually not only because of your disease per se, but where you are getting the seizure attack, which circumstance you are under. You are on the road, you are at some height, you are trekking, you are swimming, you are doing any kind of activity, and maybe it is your first time, maybe it has been happening over a long period, and maybe you have missed your dose, and then these circumstances can definitely make it fatal.
Very interesting and very enlightening. I'll bring in Dr. Abeer, and since you are Preeti ma'am's doctor, I believe, and you've been treating her, I want to add to what Dr. Nikita said. I want you to add. So, tell me, doctor, is it how prevalent is it? Number one, how serious it is among those who are afflicted by it, by epilepsy, and what is your experience in treating patients generally? She gave some points. Would like to add.
So basically, first talking about epilepsy, as Dr. Nikita rightly pointed out, epilepsy is one thing which has been probably very misunderstood thing. Now, I remember epilepsy has been prevalent since, you won't believe, since ages. Since actually the first epilepsy in literature what we have is about 6 centuries back. And then that time also there was a lot of myth about that. That time also you will see a literature in which patients or the people with epilepsy, they were given some ox blood.
Oh God.
They were actually burnt also because they were thought to be some demon evil spirits or demons having possessed. So yes, the whole purpose for today and for every time talking about epilepsy is to tell the people with epilepsy and their family members is that epilepsy, yes, it is prevalent. It is prevalent to an extent that 1 in 100 is getting an epilepsy attack throughout the world. But even though 1 in 100 is a big number. But when we come across in our clinics, it's not the 1 in 100 which we see. And the reason for that is a lot of people are hiding at their homes.
Yeah.
A lot of people are being shunned off from a proper treatment for that. And that is where we as a neurologist, we as the doctors, we probably as the people with epilepsy who are fighting against this epilepsy, we feel bad. That something which is treatable, something which is actually controllable, why not we actually go on the right path and treat that? Because else Dr. Nikita has rightly pointed out, if not treated, this can be fatal. I had a patient probably 3 days back, a very young girl about to get married, has an epilepsy and very shy about that epilepsy. She actually was very fearsome and shy about epilepsy to an extent that she was about to get married and her main concern was not epilepsy. Her main concern was, will the society accept her? Okay. Will the in-laws accept her? And what will be the response if she gets an epileptic attack right after the marriage, during the marriage, or in her normal domestic life?
Yeah.
And I had to, call her in-laws, explain them what epilepsy is. Initially they were like, nahi sir, क्या कह रहे हो, हम में किसी को हो जाएगा, उसको किसी को हो जाएगा. But then thankfully they were good people, they did understand that it really takes.
And let's do it very clearly, it doesn't spread.
Yeah,
There is
it doesn't
no way.
spread.
Tell everyone that.
Yeah, epilepsy does not spread.
It is not contagious.
Yeah, it is not contagious. I cannot overemphasize it much more than this, that epilepsy is not contagious.
Yes.
Kindly, we have seen a lot of people I remember once we were going somewhere, one patient actually had an epileptic attack in front of us.
It's happened with me. I've had a seizure, people are not touching me. They're not refusing to give me first aid because छूने से you will we will not help you in first aid क्योंकि इनको छूने से हमको seizure हो जाएगा.
So I had actually
experienced
seen,
it,
and
yes.
before I could reach, I was like, आप क्या कर रहे थे? नहीं sir, आपने, and they did, of course didn't know that I was a doctor. It was on a street, and they were like, नहीं sir, आपको भी हो जाएगा. I was like, no, it's okay.
But that is really odd. I mean, in this era, we need to really spread awareness.
Yes.
I'm so glad we're talking about it.
Yes.
Yes.
And the second part, you were saying that treatment and recovery. So tell us, what are the chances and how good is treatment today?
So yes, the treatment has evolved a lot. Earlier, one of our patients, people with epilepsy, they had a everlasting two myths about the treatment. One, sir, treatment will have a side effect. Second, sir, treatment will go lifelong. So let me first explain you why the treatment works, how the treatment works. So as she said, that epilepsy is short circuiting of the wires inside the brain. So what a treatment actually is doing is, it is putting a tape on that wire. So just exactly how probably you guys are doing it at your home place, whenever a wire short circuits, you put a tape on that. Our treatment works exactly the same way. You put one tape, you see if the short circuiting has stopped. If not, you increase the tape or you change the tape to another tape. So that is how we have about 20-30 types of tapes, what we call as an anti-seizure medication or an anti-epileptical drug.
Through medication, you have to
Yes.
basically hoping
So
to.
some
Control.
drugs,
Control.
we control the epilepsy. Now that drug, maybe one drug, maybe two drugs, maybe three drugs. And if the seizures are not controlled by that drug also, then also we have surgical methods. We can actually pinpoint the area from which the short circuiting is starting, and then we can, if possible, we can also transect that area. We can cut that area out so that the epilepsy stops.
I'll stop you here for a minute, although you use the word stop, and we must to come back to the patient.
Yeah.
So how did you discover that you are a person with epilepsy, and how has it evolved in your life? How has it affected your life?
So as I was growing up, I realized I was little different than my sibling. I realized I was being treated little differently. I was not allowed to go out like normal young teenagers, night outs and spend out. But because I was so drowsy, I was so drugged, especially because my medications, I couldn't afford to miss my medicines. My father was from the army. He says, like, your medication is like your armor. You miss one medication, you will have a seizure. So as I was growing up, it was like normal routine for me. But when I realized in school and college, I could not cope up. I could not get even more than 40% marks because I was so sleepy, which is why I feel today the need to go to schools and educate them, and this in the classes, that when you have a seizure and a young girl, 15 or boy has a seizure in a class, the students and teachers need to be educated how to give first aid firstly, and not to reject a student when a seizure happens, because obviously they will go home, they will tell the parents, and the parents also give those age-old myths, oh mata aa gayi, us bacche se dur rehna, usse baat nahi karna.
Yeah, we were talking about that. Just to interrupt, instead of asking them, let me ask you, how do you give first aid?
I'll tell you that. So if by chance, I have faced so much of rejection when a seizure has happened, which is why I want to advocate to people. When suppose a seizure happens, make the first, if you are wearing a jacket, or if you are wearing a shawl, or you are carrying a briefcase, आम आदमी चलते चलते ये सब carry करता है. If suppose it's happened to me in sector 17, it's happened to me in the railway station, it's happened to me on an airport. Some people, the world is not unkind, but the world is kind, or world is cruel too. Some people have helped, but some people have not helped. People usually crowd around, suppose it's you and you see anybody having a seizure, just get the crowd apart first.
Right.
And take out your jacket or shawl or briefcase, put it under the patient's head, and correct me if I'm wrong, put them on the left side, because the spit may go into the windpipe and they may choke. Put them on the left side and because the patient is jerking. The patient is jerking, and and that's why the head needs to be cushioned. and they should not hit, there may be furniture, there may be stones, there may be something lying there, they should not hit their head. Look for an ID, mobile or something to contact the family members. Because it's just a matter of 5-10 minutes. People will try to juta nikalenge,
It
loha
carries on for about
nikalenge,
5 to 10 minutes?
maybe even less.
The basis here is seizure lasts for 5 minutes. 99% of seizure lasts.
And you should try to time the seizure, and if it's more than that, then try to call an ambulance or doctor if it is more. And usually people try to steal mobile or try to keep the belongings with
But
you.
is the world so bad? I mean,
It's
is that-
happened with me. It's happened with me. Somebody stole my mobile, somebody stole my chain or whatever. Uske baad I don't carry any cash
There
with
are all
me.
kinds of people.
There are all kinds of, but then most important is be with the person, because it's so confused after the spasm. The whole body is in a spasm. It's pains so much. It's like till you don't get epilepsy, you don't get it.
And what happens to your mind at that time?
You're
Do you
so
recall
confused.
later?
You're so confused. Your head is spinning and you're so confused where you are. So you want the person to be with there. Don't worry, I'm with you till somebody comes. There's no idea. At least punch out the person home. And stay with the person. It's okay, I'm with you. Because you're so hazed and confused. Main kithe hu? Where am I?
Has it happened while you're driving or swimming or running or doing something like Dr. Nikita?
I have not been driving. But I guess I tried driving once and I froze on the road because a person came under my wheel. After that, I quit driving. So after that, I plead everybody watching this, if you are a person with epilepsy, do not drive, because you can jeopardize your own life. You can jeopardize any innocent person going home, any patient, and any child, any youth going home. You can jeopardize their life. Please do not drive if you're under medication. It's not allowed. You can just you can cripple yourself, forget dying. You can cripple anybody, and because the medication is in your blood. You should not drive. Take a chauffeur-driven car, enjoy life, and go by public
But if you
transport.
can't afford it, then find your way.
Yeah,
somehow.
I mean there are other ways. I mean, but don't ruin somebody's life.
I'm going to come back to you. So, how do you treat someone who's, let's say, not been treated? Is there immediate relief? Is it long term? Dr. Nikita?
Yeah, so basically if a patient is having seizure in front of you and they happen to seek a medical advice like during emergency, so we have certain emergency drugs in the form of injections. So you give them so that at least that episode of seizure is immediately switched off, basically if the episode is going on. So you can put an immediate relief, that is like the first aid. But like we already discussed, like seizure generally lasts for 5 minutes. So this medical emergency is bound to happen when the seizure is going excessively beyond 5 minutes. The patient is not, stopping to seize even beyond 5 minutes, 10 minutes, 15 minutes, आधा घंटा हो गया, the seizure is still going on. Then definitely you have to rush to the nearest emergency, nearest hospital, so that the patient gets some injectable medication. Like she already discussed, first you give the first aid in the form of, lay the person down, make safe, avoid the crowd, don't put anything in the mouth. That also I wanted to add one thing. No handkerchief, no chammach, or put your fingers, anything.
Put them on the side, she said, so that the saliva doesn't...
Yeah, on the side, lay them down, relax, don't overcrowd, because you are just cutting off the air which is actually coming to the patient. So just don't overcrowd the place. And then if you feel the seizure is not finishing and it is going beyond, then you go to the emergency and you get those injections done.
So, Dr. Abeer, bringing you in, what is the cause of epilepsy and is it curable?
Yeah, so a very important question considering today's discussion, causes for epilepsy. Causes for epilepsy, we divide as per the age of onset. So we have 3 onsets, so let's be very clear: childhood, adolescent and elderly. Childhood, whenever epilepsy, we have seen a patient on even the first hour of his life, the patient can have a seizure. So whenever the patient has a seizure in the childhood, we look for genetic causes, we look for any insult which happened during the birth, or we look for any infections. So genetic, infections, or any insult during the birth. In elderly, we look for something reversible. Something reversible like deficiency in sodium, a very important salt in the body. Decrease of glucose, again very important for the brain, or some tumor type of thing in the brain. In the adolescents, we generally look for traumas, any trauma, post-traumatic epilepsies, any trauma to the brain which may have caused an epilepsy, or any cause which again can overlap with both childhood as well as in elderly. So having said that, a lot of people, they come up to me asking, are there any genetic causes for epilepsy? Does the epilepsy pass on to the next generation? So yes, about 30% of the causes of epilepsy are genetic, but that is not a rule that if you have an epilepsy, you will pass it on to the next generation. Not at all. In fact, even if the genes are being positive, you have to get it checked twice before making a conclusion that I'll pass on my epilepsy to the next generation. The live example being Preeti here. So who, yes, is a person with epilepsy, but her daughter is a doctor in US and definitely she's not epileptic. I can certify that. So coming back to, is epilepsy curable? So yes, the big answer is yes, yes, yes. Curable definitely depends upon your cause. As I listed out some causes right now, we have to figure out the cause for an epilepsy, and epilepsy, if the cause is reversible, like sodium deficiency, glucose problem, in fact any growth in the brain, any infection, you control that, epilepsy gets controlled. Like one of the very common infections in Indian setup is something called NCC, जो हम सरल भाषा में कहते हैं दिमाग में कीड़ा घुस गया. You need anti-epileptic, the drug only for a year, and then you are epilepsy free. Just imagine, epilepsy free, you are cured of epilepsy. So hence, yes, epilepsy is curable once you find out the cause for it. 50% of the epilepsies are, we call it something called idiopathic, in which there is no cause. In that, the common myth कि epilepsy की drug तो only 3 साल चलेगी. Yes, that is true for that, that setup in which the cause is idiopathic, in which we really don't know the cause. That 50% of the cases. So out of every 10 epileptic people, 5 are idiopathic. In that 5, we can treat, we can cure the epilepsy. So on today's platform, I want to tell everyone with epilepsy, kindly get yourself checked so that yes, let's take one step ahead to cure this epilepsy.
Absolutely, and this is so inspiring for anyone who's watching. I mean, the families, the caregivers, the people who may not have yet seen, there's so much strength coming out of this knowledge, and without awareness, there's nothing.
Definitely.
And so just one minor, or may not be minor, there are other types of convulsions as well. It's not all epilepsy.
No, very good question regarding that. So I'll come back to the same model which we had was about the short circuiting. Now short circuiting in the brain circuit. Now just imagine the brain circuit having a lot of buttons, just like our buttons in the at house. So one button is for the hand, one button is for the leg, another button is for other hand and other leg. So if these buttons are getting short circuited, my this hand will move, my this hand will move. So this movement is called convulsions. But not all convulsions, but not all epilepsies are convulsions. Some epilepsies are also called sensory seizures. For example, the button that short circuits is the one which is controlling the vision. So in that, one kind of epilepsy in which we tend to see a lot of different colors. The colors will persist for a few minutes and then the patient will go into a confusion state. One epilepsy in which I start smelling something different. Okay, suddenly the patient will say, मुझे कुछ अजीब सा स्मेल हो रहा है, कुछ थोड़ी देर के लिए स्मेल हुआ एंड देन ठीक हो गया. Another type of epilepsy is in which हाथ में झुंझुनाहट हो रही है, पैर में झुंझुनाहट हो रही है. Another very rare type of epilepsy, but Preeti was today only discussing about something called abdominal epilepsy, in which the patient has sudden onset severe pain in the abdomen and then it relieves. And the patient has a frequent trips to a lot of gastroenterologists, a lot of endoscopies, a lot of things, and finally the patient is diagnosed with abdominal epilepsy. So not all the epilepsies are only convulsions. Some epilepsies are sensory seizures. Some epilepsies are complex partial seizures, in which we tend to get confused and we tend to stare right into the space like. So kindly know that all these are epilepsies. Meet your doctor, meet a neurologist, find out the cause, find out the cure. Because epilepsies, yes, are treatable, are curable, are controllable.
Very well said, very confidently and very clearly. I think we're all very clear about that. Preeti ma'am, coming back to you are a crusader, you are the champion, and you have been, and there may be others like you, you've been speaking about epilepsy, you've been a TEDx speaker, you've been writing. So what is your purpose and what are you trying to achieve here?
Sir, I want to, there's a lot of work has to be done yet. I still haven't reached my purpose yet, and I want to tell to all the people with epilepsy and caregivers. Epilepsy is a very, very small part of your life. बहुत कुछ करना है. And you can achieve so much more. I have rappelled down an 80-foot mountain. You can do anything. You have dreams, achieve them. Epilepsy is a very, very tiny part of your life. Just take your medicines and go. You have dreams, fulfill them. I had, in fact, sir helped me, sir guided me, sir helped me. I had the dream to be the first epileptic on a TED platform, and I went and achieved my dream. I wrote books. I've made my daughter a doctor. सपने हैं पूरे करो. Epilepsy हो या कोई भी बीमारी हो, उसको उसके औकात दिखा दो. Epilepsy is nothing. It's just a very tiny, small dent in the car. That's it.
Very well said.
So
very, very well
please,
said.
please don't इसको इतना हवा मत बनाओ. And family members of epilepsy, people with epilepsy, don't put them in a cocoon. Let them breathe, let them fly, let them live their lives. Look at me, there's nothing wrong with me. We're very normal people. Don't stigmatize us. Let us live, let them live. And they are very beautiful people. Where God gives you one disability, He gives you 4 talents or 40 more talents. Trust me. So there will be your people with epilepsy, you just have to open up the wings. They will fly. They will glamorize them. I mean, there's a lot more to do. Life is not ended.
Absolutely. I think the message is very clear. The inspiration is now overflowing. We are all wearing some part of purple here. And that is only to highlight. The purpose of this episode is to highlight the fact, to make people aware. And then look at the person with epilepsy who looks like a person with extraordinary capabilities instead of, and also chalo epilepsy, let's be
side mein karo, epilepsy ko side mein karo.
But be conscious of it, treat it, cure it. So any last final advice, one sentence, 2 sentences about epilepsy?
Yeah, so epilepsy, like both of them have mentioned, it's just a stigma. So get out of it. It is curable. If you know how it is happening, just get it treated from your neurologist. And you should know your triggers. What are the triggers? If it is lack of sleep, if it is, missing your tablets, or if it is just, being in a very crowded place, loud noise, flashes of light. So just identify these triggers and try to avoid them. So that will make you in a safe, secure environment, provided you are having your treatment. So don't miss your tablets.
Yes.
Well said. And lastly, Dr. Abeer, also asking you, so technology and medication has improved also over the years. So it's not like the drugs are very difficult to have or anything. You want to end with that?
Definitely. A lot of time before, like probably even 10 years back, if we go 10 years back, a lot of patients were very apprehensive of anti-epileptic drugs because they would cause, sleepiness. They would make you groggy throughout the day. But yes, with the advent of a lot of advancements in science, we have now drugs with hardly any side effects. Now we can actually blindly give a drug and say, okay, you will be off any side effects, kindly adhere to these and you will be free from epilepsy. So yes, now the time has come to discuss with a neurologist, and even if you get a side effect, discuss with a neurologist that, sir, I am getting this side effect, kindly switch to other drug or decrease the dose. We have a solution to everything now, everything.
Wonderful.
So coming to the final say from this thing is epilepsy, find a cure, get a cure and lead a normal life.
Well said. I think a round of applause for all 3 of you. Fantastically well done. This has been an extraordinary episode of the Good Vibe Show. We have touched a very important topic of society. And all of you watching, please share this information with others. Please share this episode with others. And if you need to get in touch with the doctors, Dr. Abeer and Dr. Nikita, and the person with epilepsy who's an outstanding individual, Preeti ma'am also. Thank you for coming on the show, all of you.
Thank you so much.
Pleasure to have you.
Thank you.
Thank you. Thank you.